Hello everyone. So today our case is case number 464 of Madison. A 15-year-old girl who is a known case of diabetic mellitus presented to the emergency room with confusion and drowsiness for 2 hours. Her mother reported that she had fever, abdominal pain and vomiting for last 4 days. Her random blood glucose is 464. This is our case number also. Arterial blood gas reveal pH of 7.29. What is the normal value of pH of the blood? Yes, you know, 7.35 to 7.45. And PaCO2 is 33 mmHg. What is the normal value? The normal value is about 35 to 45 mmHg, and bicarbonate of 12 millimole per liter. What is the normal value? This is 22 to 25 or 26. So, what is the most likely diagnosis? Uh, Alpha hypoglycemia, beta diabetic ketoacidosis, also known as DKA, Charlie lactic acidosis, and delta hyperglycemic hyperosmolar, non ketoic coma. So, I'm going to give you 5 seconds so you can think about it and answer by yourself. Yes, the answer is B, diabetic ketoacidosis, also known as DKA. So let's discuss why this is the answer. So our answer is B, diabetic ketoacidosis, also known as DKA. Why this is the answer? Because first of all, this patient is presenting with severe hyperglycemia. Anytime the glucose level goes up to more than 250 mg per deciliter, we call it severe hyperglycemia with symptoms, and this will suggest the two diagnoses. One is DKA, another is HHNC. What is HHNC? This was our D option, that is hyperglycemic hyperosmolar non-ketotic coma. So, uh, and the second thing we have to differentiate between them. What will our criteria to differentiate between them, DKA or HHNC? So I will tell you this. Then next we have to check out what is present in our question. This is number one thing. This is acidosis. So the patient pH is less than 7.3. So this suggests that the patient is going into acidosis, and also the bicarbonate are less than 15. So this confirm our case of DKA. In HHNC, we do not see this pattern. Moreover, the patient has abdominal pain, vomiting, and fever that are suggesting of any infection, and infection is actually a triggering factor for DKA, and also dehydration. So dehydration is basically associated with HHNC. For confusion, this is there, but infection is a triggering factor for DKA. Also, we have acidosis like bicarbonate are low, and pH is also low, that has been given in the case. HHNC usually has milder acidosis, not severe acidosis, or it don't have acidosis at all, and the glucose is much more higher than this. So it is more than 600 milligram per deciliter, and I told you it present with dehydration. Okay, so the case is of diabetic ketoacidosis. Let's discuss why not the other options are correct. Number one option E was hypoglycemia, blood glucose level is high, so this is not the option at all. And number C was lactic acidosis. Although lactic acidosis can cause metabolic acidosis, it does not present with hyperglycemia. So hyperglycemia was present in this case, and the most confusing one, the hyperglycemic hyperosmolar non-keto coma, was typically it occur in older patients. So epidemiology is also important with the type 2 diabetes. Okay, remember that this hyperosmolar hyperglycemic state, also known as HHS, is present in type 2 patient, which are obviously older patient, and type 1 patient and mostly younger patient, because type 1 is due to Yes, it has genetic factor most commonly, and type 2 has a different epidemiology and has minimal ketosis. So ketoacidosis mean acidic environment. So it has less acidity as compared to DKA and present with severe dehydration as I told you, and very high glucose more than 600 mg without significant acidosis. Okay, so remember that whenever you have a patient with who have older age, who is type 2 diabetic and who has normal or very less change in acidity, and he has dehydration and very high glucose, this is the suggestion of HHS or hyperglycemic hyperosmolar non-ketoicoma. So and this and that's and there, in this way you can differentiate between them. Okay, and lastly, I have written some notes that will help you in the future questions. What is the most common precipitating factor for DKA? Precipitating factor mean that increase the risk of DKA. So this is the infection, and it promote the DKA formation in these patients which are already type 1 diabetic. And what is the first step in DKA management? Is the IV fluid. Usually we use normal saline. Okay, and why is potassium replacement important in DKA? Remember, this is very important concept, so I want you to pay attention to this. So guys, what happens when there is DKA? So DKA is actually affecting the type 1 patient. Type 1 patient having very low insulin. Whenever there is a low insulin, the potassium will come out of the cells. Okay, so potassium is coming out of the cell, and we think that the patient is going into hyperkalemic state, but this is not the actual hyperkalemia, because the cells are already depleting of the potassium. So okay, so we initially see hypercalcemia, sorry, kalemia. So after we start the insulin therapy, or we start the IV fluid, the potassium will start to go inside the cell, and we see a dramatic decrease in potassium level. So it's important that we consider potassium replacement therapy in DK patient, because the total body potassium is depleted despite the normal or higher serum potassium level initially. So why normal or high potassium level are present initially? Because of this phenomena I told you already. Whenever the insulin goes down, the potassium move out of the cell, and when we treat this patient, that there is a dramatic decrease in potassium levels. So we have to monitor this, and we have to do potassium replacement, because this is very important. And what is the difference between DK and HHS? DK has metabolic acidosis with ketosis, while HHS has severe hyperglycemia and dehydration, that we'll talk 2-3 time. Okay, and also this is a type 1 phenomena. DK and HHS is more commonly seen in type 2 patient. Okay, so I hope this video help you and give you some concept, and for more videos like this, please like and subscribe to our channel Sword of Knowledge. Thank you so much for your attention.